and the trained subject is a biochemistry PhD, has been active for 20 years as a PT, and he has trained all over the world in Europe, Asia, the Middle East, and he is the contact for Spain and Greece for the glucocholic, and for 10 years he has managed the Rebody personal training studio in Barcelona. He is our next speaker, and you will actually show possibilities, the best of your many years of experience, the essence, basically, yes, the essence that I recommend to the people that I train and my customers. And I can tell you why it works a lot better with EMS. First of all, a very warm welcome. Thanks for being here with us. This is my first time as an EMS symposium speaker. I am new to the EMS area. I've been active in this area for 2 years. Before, I was pretty skeptical about EMS and the way it was communicated externally. But after I actually talked to Stefan and Jens, and I really talked to people who deal with EMS, I found that I had to actually remove my blinkers to see the rest of the world. And now I am no longer skeptical. I am really an EMS addict, a fan. Over the past 2 years, I have trained my customers. We've been in functional training for a long, long time, and the corrective training, although I don't like the word that much, but most people understand this term, and if you don't, I'll explain it to you. So this is going forward, yeah. So what is corrective training? Sorry, my accent is a mixture between Greek, Spanish, German, and English. It's not good, but I realize somehow people understand me. There will be a few Greek and Spanish words in my presentation, but bear with me, it's only 20 minutes. What I'm going to present is basically just one view. It's not the Bible. It can be disputed, fine, but this is food for thought for you, to develop a different view on things and what you probably do. Maybe it confirms what you do. I think it is great what we've seen so far today. Let me now present my way of thinking. Maybe we can also do one little exercise if there's enough time. In the corrective training, this is basically part of functional training, and the focus is on individual exercises, arbitrarily selected exercises that are thought to work. Before I correct something, I first of all have to see the problem, not only the disorder or the problem or the pain, back pain, for instance, whether this is the real problem. Maybe this is just a symptom of another disorder. Maybe this is only one way of your body to tell the owner of that body you're doing something wrong. So the analysis is the most important thing for me, the first step. So I first have to look where the problem hails from, to find the driver of the dysfunction, the root cause. Often it is the spine, maybe it can be the feet or somewhere else. And once I have detected the problem, the root cause, and I can tell you that very often it is what people think it is, next I develop a strategy, a personalized strategy for that patient. Something that works for the person's abilities, for their work, their everyday routine, and also tuned to the patient's objective, what he or she wants to achieve. Maybe they want to actually simplify their life, or maybe they want to improve their performance. In English, it works fine. These three terms. In English, it is so easy. The ABC of movement A is alignment, B for breathing, and C for control. These three elements are really important. Many physiotherapists and many of our colleagues, our colleague trainers, actually lose out on much of this information. We still, I think, although we have so much knowledge, we still focus on the superficial muscles, the lateral muscles, but often forget that our being, our trunk, our core is controlled by the deeper muscles. And this is why I say first focus on the alignment, then focus on how we breathe. From my experience with my customers, I can tell you, and the people that I've trained over the past 20 years, I know that most people think they know how to breathe properly. Most young people don't, in fact, and they're people that have never correctly breathed ever in their lives. This is a shocking insight to see this. And it empowers me because I know what this can do for people. And last but not least, control. And this is really the last point I want to touch upon. Alignment. As in A. I am always talking about the thoracopelvic cylinder, the TPC. This is very hard to say in German, but it is pretty catchy in English. And we have to understand what this TPC comprises. We've got the sternum, we've got the ribs, and the pelvis. So it's like a barrel or a cylinder, and this is why we refer to it as the TPC, the thoracopelvic cylinder. And in between, there's also the diaphragm. So since I'm allowed to touch my customers, I can also touch the rib cage. And last but not least, you've got the pelvic floor, which is important. So this is basically the complete spine, especially the lumbar spine and the thoracic spine. We know, of course, we've got lordosis, we've got kyphosis. We always know when we see such a patient with a deviation, then this is a fact. I can't change it. I'm not a therapist, so I have to live with this dysfunction. And this is a basic mistake that many instructors, many supervisors make. They actually accept a malposture, a poor posture. This is the wrong approach. If we say hypertrophy, I want better control, I want better alignment, then I, of course, also want to achieve a better posture, a better alignment. I don't want to actually bore you with the whole presentation because you can take photographs of it and you can actually download it later through the QR code. What you see here is this structure. This structure always needs to be intact. Of course, the thoracic spine can turn, and the lumbar spine also has a tiny movement percentage. I always ask my students, what is the percentage that the lumbar spine can turn in total? From L1 to L4? Well, probably you don't want to tell me. Shall I tell you? Max 12 to 15 degrees. 15 is already too much. So the ability to turn the lumbar spine is very low. And very often we put too much strain on this part of a spine, and this is what results in problems later. In the thoracic spine, when I have this stiffness, constant stiffness, then I have this problem because the upper part is stiff and the movement must take place in the area that can actually not move that much. And then you have this vicious cycle. How can I overcome this? And this is this is what I often see on YouTube, the mobility freaks. They try to correct people with a mobile hip, a mobile lumbar spine, so that you can actually fight the back pain. This is wrong again. The whole system needs to be reset or rebooted instead, to my mind. This is a very good example of a runner, of a jogger, and a golfer. How can the golf player perform a swing without actually turning the thoracic spine and without turning the spine? You must be crazy. Well, to my view, this golf player has forgotten a movement or a motion from the hips and from the shoulders. The thoracic spine should actually be the last to act. Only in the movement, not when the golf player actually hits the ball, especially when you have a previous disorder. I hope you understand me. To get things straight, I need a stable cylinder, a stable TPC, so that I can achieve mobility. Start with the fixum is the feet and the hands, and what we move is the spine in between. Our fixum is our spine, and the rest should be moving. So we're actually approaching the thing incorrectly altogether. You know how babies work the first months of their lives. They are actually very stiff in their thoracic spine. And now back to my friends. For many of our friends, the trainers, the rule is, well, you have to strengthen your back muscles to avoid back pain. Then others say, well, strengthen your belly muscles to support your spine and to get rid of back pain. And I say, fine, of course we need muscles, both in functional terms and in appealing terms. But these muscles are first and foremost designed to provide mobility. The 24-hour stability that keeps us going, that keeps our cylinder upright, this is the internal muscles. And we have to think about the pelvic floor and the diaphragm and the psoas. So we've got the top lid, the diaphragm, the pelvic floor, and we have two long cables. And these two long cables, the psoas major and the psoas minor, are the two muscles that actually perform the work. But how can I activate these two muscles? Psoas is a known muscle. What does the psoas do? No? I'm talking to you. Can you understand me? Because you're looking at me so blank. No, it's the extensor and the curler. Who knows that the psoas actually curls the hip? It hardly works for that. 90 degrees max. All of the rest of the job is done by other muscles. So forget about it. This is too long. I can't read this out for you. What's important to understand is the diaphragm. What is the main task of the diaphragm? How much time do I have left? Okay, more than 5 minutes, fine. What does our diaphragm do? First and foremost, exactly, breathing, exhaling. So the major function of diaphragm is breathing. The second function of the diaphragm, I won't give away the third one. What's the second function? Stabilization, stability. As I show it, it is the lid, the pelvic floor below, and the connection between the two. And to make it really work fine, the diaphragm, how many dimensions does the diaphragm have? Oh, God, you're so shy. 3 dimensions. Front, back, and parietal. Before we continue talking, I would like to explain to you how to breathe properly. We can do an exercise together. Yeah, some exercise. Yeah. Sebastian made me exercise. So take your hands and cross your hands and try to touch your own costal arch, the ribs, and keep the hands there in this area. I do this with my customers, with all my customers. And the way you are now, try to feel your breathing. Breathe in through the nose and breathe out through the mouth without opening the mouth. So press it through your lips. And then feel your costal arches again. Breathe in and breathe out again. Last time, you can also close your eyes, breathe in through the nose and breathe out, pressing the air through the lips. And relax now. Let your hands loose. Who felt a movement in the front area of the belly? Okay, some of you. Who felt something parietally? Again, some. Who felt something at the back? Fewer, even fewer. And that's the problem we often see. When we breathe and want to activate the deep muscles, then we constantly have to work in the 3 dimensions of the diaphragm. When we sit, we don't need that breathing. But this movement patterns are important in all 3 dimensions. So 3-dimensional breathing is really the be-all and the end-all for stability and movement control. Let's go one further. This is what I showed you in the diagram before, and this is what we exercised to see the importance of the diaphragm and the pelvic floor to activate all of the muscles. Breathing is so important. It is for respiration important, but it's also important to stabilize, to mobilize, and to decompress the spine, to create this decompression to really have space. So this is one of the best mobility exercises for your body. Breathing. Exactly. This is the most important exercise. When somebody really has a problem with the skeleton, with the back, and doesn't stand a chance of moving without pain, then this person should train breathing properly. And as soon as this person breathes properly, we can correct the rest. Let's come to the last point, control, and then we will actually transfer our knowledge to EMS. Very often, you don't understand this term of control. Control no longer just equals stability, because stability sounds like stiff. No. To me, management control is the important term, whether it's a posture, the basic posture I did with Sebastian, or a movement. We refer to this as the static or the moving stability. And this is actually correlating to the way we breathe. And alignment plays a role here again. The pelvic floor, the diaphragm, and the muscles around the spine. If the correct breathing places all of these elements in the right position, and if I breathe 3-dimensionally, then through the inter-abdominal pressure, I can actually correct my spine. And this intra-abdominal pressure is well known to competitive sports. I can really regenerate high strength without actually placing a load or a strain on my spine, and everybody can do that. This is a key technology you can use to help patients with acute back pain. The first thing I go through with my customer is an assessment of proper breathing. To actually teach patients right breathing. This is Pavel Kola. This is the IAD optimal, the intra-abdominal pressure, the right breathing. And he now actually has brought about and accompanied many Olympic winners. and he's taught them how the core works and how the EAD can be optimized. And how would you actually transfer it to EMS training now? What's really special, and I actually provided training in Athens 2 weeks ago for new EMS instructors. Well, I said the big advantage is you have this great vest, which looks so sexy. You don't have to actually use your hands. But the vest, the waistcoat, really helps you with breathing. As soon as you wear the vest, you have to actually feel the control as a customer. You can actually point out to the customer that breathing should be around the body. And you can actually visually accompany this person. When somebody comes with a white T-shirt, you can't see whether the costal arches are moving. In the waistcoat, in the vest, I can see it immediately. So I can see immediately whether the customer breathes right, regardless of the position and the posture. In the strength program, I can use it, for instance. What could I do for a beginner, for instance? How would I do it with a beginner? I don't want to overtax a beginner and provide too much information. So in the off time, the person can actually actively breathe in and out, and in the on time, the person can be more relaxed. So you don't have to focus on your breathing. But the better the control, the easier it is to actually introduce controlled breathing into the on time. And then constantly in the training. The feedback I get from my EMS customers is, wow, this is really hard to do. It's so stressful. I heard this from people very often. I can't feel anything. I can't feel anything. Through activation of the right breathing, we are able to actually do a lot more and be far more functional than before. And now the little thing. We know that EMS actually works fine with the superficial muscles. Hypertrophia, fiber, collagenous fiber is converted. Now, let's imagine that we're using the inner muscles and the outer muscles. Just imagine the possibilities, both for the back and for strength and performance. It would be a fantastic alliance. I know that there are studios that already do this, and this was my incentive for starting with EMS, saying that even the deep muscles can be involved in EMS training. The Multifide studies, for instance, presented by Jens, he taught me about it. I think that we should actually build in this topic, and that we fare a lot better when we also involve the inner muscles, not only for training, but also for old age. And that was all I wanted to tell you. Do you have any questions? Anything at your heart? Have you understood me at all? I know. It is explosive, and I'm talking very fast. I've bombarded you with information, but I really wanted to give you my view and tell you about how I try to convey these things to my customers. If you don't have any questions now, we break for lunch now.